Welcome, everybody. It's Randy Van Straten, VP of Business and Community Health at Bellin Health. So happy you could join us today for our Total Health Spotlight today. And we are spotlighting, basically we're calling this a tale of two partners, how the village of Ashwaubenon and the Ashwaubenon School District partnered to revolutionize healthcare in the Ashwaubenon area. It's really about our total health package and our companies working together to achieve positive health outcomes for their workforce and get this at a lower, more affordable cost for all. And I'm going to introduce you here to the folks that made it happen. So first of all, on screen, we have Jody. Jody, you want to introduce yourself? And, if you could just share with us, how many years you've been with Ashwaubenon, and just for fun for this, how about your favorite concert that you went to too? So your role, how does that sound?
That sounds good. Hi, Randy. Thanks for having us. My name is Jody Smith. I'm Human Resources Coordinator for the Ashwaubenon School District. I am in my 30th year with the district. And I would say my favorite concert was Elton John when he came here to Green Bay. That was a good one.
Right here in Green Bay. That's a good one. That's hard to top.
I was very pregnant for that concert, so I remember sitting through it.
That's great. Let's move over to Keith.
Hi, Randy. I'm Keith Lucius. I'm the Assistant Superintendent for Ashwaubenon School District. I've been here 25 years now, and the concert that is most memorable to me is a KISS concert I went to 7 or 8 years ago. And the reason it's so memorable is I wanted to go when I was in middle school and my mom wouldn't let me go. And this was my chance to finally get to see them before they stopped touring.
Oh, that had to be just a spectacular concert. They're on my list. I wish I would have seen them in Crandon when they came to Crandon. All right.
Yeah, it was nice. I was able to text my mom a picture and say, see, you couldn't keep me now, keep me from going. So
that's great. That's great. Let's go over to Joel.
Hi, Randy. Thanks for having us today. I'm Joel Gregozeski, Village Manager for the Village of Ashwaubenon. I've been here just over 3 years, so my tenure and relationship with the A+ Clinic has been a little bit shorter than Jody and Keith, but very much appreciate and enjoy the relationship. I think my most memorable concert was, and I'll preface this with, I have obscure musical tastes. I'm a Gen Xer growing up and coming of age in the 90s, so I like punk rock and ska music. So my favorite concert was Less Than Jake at Summerfest in the early 2000s.
Oh my goodness. Okay, that's a new one. I'll have to go out and Spotify that one after this.
Less Than Jake.
Okay, great. Well, thanks, Joel. And Bellin's very own Marissa. Why don't you introduce yourself, please?
Thanks, Randy. I am Marissa Zorn, the nurse practitioner at the A+ Clinic, and I've been with Bellin about 7.5 years. And my favorite concert was probably Journey and Pat Benatar.
Classic.
Yes.
Definitely heard some classic 80s going on, and I'd have to chime in. My favorite concert was my first real concert I went to. Remember the old Brown County Arena? And it was Van Halen back with the David Lee Roth Van Halen. And then their opening act, believe it or not, was Loverboy. And it was pretty spectacular. They're rocking the Brown County Arena. Well, anyway, thanks for being with us. We're going to jump in here. So this partnership is really a narrative of cooperation, of innovation, and care, aiming to foster a healthier environment for everyone involved. So with that said, what initiated the partnership between the Village of Ashwaubenon, the Ashwaubenon School District, and Bellin Health? Joel?
Sure. Certainly this partnership was sparked by a desire to improve our employee health. So this collaboration with Bellin Health was a very strategic move for all the organizations to really kind of bring healthcare directly to our employees. So rather than them having to take time outside of work to go see their healthcare provider, we would have that available on site for our employees. So The establishment of the A+ Clinic back in 2015 definitely marked that significant milestone of bringing that option or that opportunity to our employees and really kind of creating a healthier community.
Excellent, excellent. How about from the school district side? Keith, anything to add?
Well, yeah, we've always worked closely, the school district and the village of Ashwaubenon together, trying to share services and do things that make financial sense for our residents and our taxpayers. And the idea of opening a clinic came up. I was talking with my counterpart at the village, and she was interested in the same thing, and we talked about it. We both were nervous about financially, would we have enough? Are we large enough? Will we have enough usage? And we came up with the idea, why don't we do it together so we can have enough hours and provide that platform? And what we found out very quickly is we were definitely large enough to do it on our own, but it's worked so well partnering with the village, and it provides so many different options for both groups that there's no reason to change the way we started.
That's great. That's great. You mentioned the name of the clinic too, A+ Clinic. I'm intrigued. Keith, what's behind the name of A+ Clinic?
Well, A+ Clinic was not something any one person came up with. We had the two groups get together and we talked about options, and it really came down to A for Ashwaubenon, but also A as an education organization means so much. And A+, it really is superior outcomes, superior service, superior everything. And we wanted to have that positive name for the clinic and know that we are going to get the great service and have great outcomes.
Right. I'm going to go over to Jody. Jody, so you've got this clinic. How does it differentiate yet partner, with healthcare services?
Yeah, I think that the A+ Clinic was a game changer when we created that. Just in the wide variety of services that are offered to our staff on site, plus the staff see the providers in their buildings, they see the providers at the on-site clinics, and they build a relationship with them. The providers provide personal and immediate resources and care to them. It has been a game changer.
Yeah, I think, you really touched on something there. You've removed the barrier. You removed the barrier and made accessibility much easier for people to just, use healthcare by bringing it right on site.
Yeah.
Now, I know back, I can't remember when, Jody, but you made a bold move of starting to offer a wellness certificate for your folks. And what that means, basically, that wellness certificate is you started tracking who was getting age and gender specific screenings completed, right? So could you just elaborate a little bit more on that wellness certificate?
Sure. Last year was our first year with that wellness certificate, and we really didn't have a number of participants that we were expecting. We were just, let's see how this works. It went over wonderfully, though. It was kind of funny because I think that our staff may have been a little lax in getting those wellness exams previously, and the certificate kind of forced them to take a look and say, hey, I need to get these exams done. It would be kind of funny. A couple times I walked into conversations that were being held out in the hall on colonoscopies. They're talking about what their prep is, or how their experience was with colonoscopies. So that was a little different. But we did have one success story that I'm aware of. We had an individual who went for a routine mammogram, no symptoms at all, and breast cancer was detected. So that early detection, and right now she's doing fine. So the wellness certificate was a definite win for us.
Wow, that's great. I tell the team all the time, our team doesn't work in the ER or surgery, but I always tell them they save lives before lives even know they need to be saved, when you think about that. And the other thing that I love about that story, Jody, is, you can look at, a lot of healthcare talks about cost, right? What's the cost of screening to the cost of, catching cancer late? There's a huge cost to all the surgeries and everything. But I saw a most recent report that really touched my heart on this. And it was basically 5-year survival rates of the different cancers from stage 1 to stage 4. And they can vary anywhere from like, survival rates at, of being 100, but then going to survival rates of very small numbers. So catching cancers early is definitely one of the key things that you do there. So prevention is really key. I'd like to direct this next question to Marissa. Now, you've been a provider at the A+ Clinic for more than 6 years. That's awesome. So you really had a chance to build some relationships. Could you please share some of the things you've done to build relationships with people over the years?
Sure, Randy. I find it to be really important to build critical relationships with patients so they feel cared for. While a lot of the patients have established with me as their primary care provider, I also have the opportunity of made it a point to customize the location of their care by going to weekly rounds at each of the local schools to deliver care right to the doors of the people that need it, to allow them to have less time away from work. I also find it important to always put myself in the shoes of my patients, and I treat them like a family member. I want them to really, truly feel like I care about them and that they're heard, and that I want them to have a say in their care.
Yeah, that's great, Marissa. I really, when you think about it, a lot of clinics like this, they're not just there they're there for acute care, but it's also about aligning and having a medical home. And that's what you've been able to accomplish there, is having a medical home for folks to get their care managed. And that's definitely key. Keith, I know you wanted to add something in here too.
Well, I think it's important to say this, and Marissa's too modest to say it, but the key to the success has been that the employees trust the provider. They know the provider cares. And we've been lucky with Marissa. We've been lucky with the other services we've had through Bellin, that people really trust and feel valued by the person. As Marissa said, they feel like family, and that trust has been the key to success. And all the Bellin providers that we've had in the different service areas have built that.
That's great. Yeah. Yeah, definitely. And I'm sure, Marissa, that keeps you coming to work every day excited to make a difference, right? So it's yeah, what a great match. So I mentioned this before, cost savings. A cost savings becomes a benefit and value to your people, right? That's important. And speaking of savings, how do you measure success? How are you measuring success of the program? Keith, let's start with you.
I think it's, when you measure success, the biggest financial savings is in that early detection and prevention side. The more we can catch those things early, what it does for your staff, but also in a school district format, keeping staff in the classroom. The best person to teach the kids in that class is that teacher. So that prevention and catching things early so we have our staff available is the biggest value that we've seen from the clinic.
That's a great way to put it. Joel, how about you measuring success over at the Village?
Yes, there's clearly tangible savings that we can see, especially on acute care as well. So not only those kind of intangible or untangible savings, but beyond that, we also have the idea, or this concept of this trusted healthcare provider. That does provide financial savings beyond just healthcare alone. So we use this, and it has been an effective tool for us for employee retention and satisfaction as well. So when an employee is considering maybe leaving the organization, it's a serious thought for them as to whether or not that the value of this benefit that we have with the A+ Clinic is going to be conveyed in, let's say, a new employer. So retaining employees has been a very effective tool, having this clinic on site. Beyond that too, when we recruit new talent to our organization, this is a huge benefit to us in that recruitment effort, to let them know that they do have a on-site healthcare clinic with a trusted healthcare provider. So it's been a very invaluable tool for recruitment and retention of our employees. And those are costs that aren't easily quantified.
Yeah, that's a great call out. Joel, because you imagine a new candidate looking at different options and probably weighing, well, here's what I get with this potential opportunity, here's what I get with this opportunity, and putting those side by side. That really puts you at an advantage. Great thought on that. Okay, now here's my favorite part of this, and that is we're going to talk about some success stories. So Jody and Marissa, I think I'm going to pick on you both for this one. So any success stories you'd like to share? Jody, let's go to you.
Yeah, the first thing that comes to mind is coming out of COVID, we had seen an increase in our EAP usage. And in our quarterly meetings with Belen, Marissa was reporting the same as well. But I think the fact that our staff was comfortable with Marissa and the team over there at the A+ Clinic, they were comfortable enough to go to her, to go to the team and talk about issues. She was a great, and she still is a great healthcare navigator in helping our staff find the resources that they need. So that's been wonderful. They work together as a team, and our staff can see that.
That's all part of that medical home. It's really treating the whole person, right?
Mm-hmm.
The whole person and managing that care. Great call out. Marissa, I'll toss the ball to you.
Thank you. Yeah, kind of playing off of Jody, we had a patient come into the clinic in a fairly significant mental health crisis. My nurse and I were able to advocate for them and actually get them treatment and counseling services next day without having to wait, which was a huge success in their overall well-being and to get them the proper care that they needed.
That's great. So individual wasn't waiting for a referral or weren't waiting to get in. You helped provide access and coordinate the care. I'm sure they felt so valued in that interaction. So yeah, again, whole person. Thank you for sharing those two. Let's move to the last question here, and we'll do this as a round robin. Okay. So this is that crystal ball one. If you were to look into a crystal ball, what do you predict the future would hold for workforce health and well-being into that crystal ball? And Jody, I'm going to pick on you again. Let's go to you.
Okay. I think that the employees' physical and mental well-being is going to continue to grow to be a top priority for employers. I think that is going to continue. Where we are now in our services at the A+ Clinic to where we were in 2015 when we began, we have grown so much. We're adjusting, and we feel like we're meeting the needs of our employees. And we're going to have to continue as things evolve.
Yeah, talk about evolving. I remember back in 2015 presenting to your insurance committee and talking to the insurance committees of over at the village too. And our first clinic wasn't even on campus. We had it carved out at our Comanche site, but it has evolved from a site at the village to off-site to now on-site in a nicely constructed clinic after you did the remodel of the high school. So these things can start small and gain momentum too. So for other folks, that are thinking about this, this has been an evolution over time. Yeah. Great. Keith, let's go to you. Crystal ball.
Well, I think what we're seeing in the hiring environment right now is attract and retain good people. School districts have become much more competitive as far as trying to hire. And I think having this clinic is definitely an advantage as we try to hire and attract candidates. We hear it from new candidates how much they appreciate it. And then the second part of it is it's also very difficult to find substitute teachers and other positions. And the more we can keep our staff in the classroom, and by having the clinic on site, they can take care of things during a prep period where normally they'd have to take a half a sick day to go to an appointment. They can work with Marissa when she does her on-site visits and not miss any time with students. So our need for subs is down, and our staff is getting taken care of better, and they appreciate it, and it's more cost effective. So it's a win-win-win-win.
Yeah. I love that. Healthcare beyond the walls. Healthcare beyond the walls. Joel, let's go to you.
Certainly. Well, we talked a lot about the great work that Marissa does as a trusted healthcare provider, but I do want to give a shout out too to Bellin Health in general and our account representatives that assist us. So as Jody had mentioned, we meet quarterly, and then at the end of every year, we meet with Bellin account execs and we review our health data for our organizations. So both the school district has an individual meeting as well as the village. And so that crystal ball becomes less cloudy and very clear. So in fact, we just had our annual review meeting yesterday. And so there are 3 or 4 specific strategies that we want to help obtain over the next year or so. And it's that relationship, that partnership, that strategic effort between Bellin, us, and the schools that allow us to target those specific areas that are going to hopefully help make our employees healthier, happier, and more productive.
Absolutely. I think you hit a key word there, partnership. Yep. Because we all learn from each other too. We're learning every time we have one of those meetings too, how to be a better healthcare provider in the community. Marissa, wrap it up with you here.
Yeah, I still see that there's going to be a huge focus on mental health, preventative care, and then like Joel kind of talked about our meeting yesterday, some initiatives and plans in place to decrease the social determinants of health and patients' risk based on our patient population. But I still see there's going to be a lot of care coordination between myself, our on-site physical therapist and occupational therapist, and registered nurses as well.
Excellent. Excellent. Well, great wrap up here. Crystal ball, there you have it. Any last words as we close this out?
Yes, I would like to thank the Village of Ashwaubenon and the Ashwaubenon School District for allowing me the privilege to not only see their employees, but their families as well, and to have the opportunity to offer them care.
That's awesome. And Marissa, thank you for basically providing healthcare beyond the walls of healthcare. You're out there where things happen and where people need you. So on that note, it's a wrap today. Thank you all for your insights. You can contact us at bellin.org/4-business if you'd like to learn more from our guests, or connect us with your insurance broker, or schedule a strategy session. We are here for the community, and thank you all, and thank you for listening. Have a great day.